All right, let's bring in North Carolina Congressman and House Ways and Means Committee member Greg Murphy. Congressman, thank you so much for joining us. Doctor, I could actually say as well, but thanks for being here with us. The big question really going into next week is the ability to spend money and continue with operations on the government. There needs to be a continuing resolution or some other solution put onto the floor so that the government can continue to be funded. Is the House going to pull it off, and how are they going to pull it off?
Yeah, Jason, I think we will. It's in nobody's interest to shut down the government whatsoever. So the Speaker has been talking about pretty much a close to clean CR with some anomalies. I'm pushing for a doc fix because it's ridiculous that physicians have been cut and paid 30% over the last 20 years when other agencies have gotten plussed up. So we need to stop driving people into employment, and the ACA is killing private practice. But along with some of those other things, what we need to do is we just need to be able to settle down this year, get reconciliation done, and the next year go through the budget process like Congress is supposed to do, really to pull things back into spending. But we don't need to shut the government down in the meanwhile.
Representative, we're going to follow that closely because my understanding is that it's a very close margin. You can only really lose one vote on this continuing resolution. And we're hearing from some that are already saying that they're not going to support it. So it might come down to the wire. So we're going to keep an eye on that.
Yeah. Well, you've got some folks in our caucus that there's not enough Jesus in the Bible sometimes. And so what we have to do is we actually have to look in toto. We have to look at the big picture to try to move things forward. This constant obstructionism by some of the individuals does no one any good. And if you shut the government down, it's a lesson to them. You need 60 votes in the Senate to start it back up. And guess what 7 of those votes are? Democrat votes, and you'll have to actually make things much worse. So a little bit of fortitude, a little bit of just actually forethinking is going to be critical for the Republican conference.
Well, I think if they can couple it with a convincing argument that rescission can come into place, that will be the top line, and that you'll actually end up spending and implementing the highlights and the cuts that DOJ has done, then it might be a winning combination. But boy, with Thomas Massie already out of the mix, you only got one to give. It'll be interesting. That's big news next week. Congressman, you also have a medical background. You're a doctor. I want to talk a little bit about Medicaid cuts, because every time you hear the Democrats, they're out scaring people. Oh, the Republicans, they want to take away your Medicaid. Look what they're doing. Explain to us what's really going on from your vantage point.
That's nonsense, Jason. The Medicaid system needs reform. It's not been reformed really since its inception. And Jason, I still see patients. And I'll give you 2 examples a few weeks ago of 2 individuals. I won't go into specific details. I can talk later. That absolutely did not fit any eligibility to be on Medicaid. Biden administration during entire COVID took away the auditing process that states had to go look at their Medicaid rolls and say, all right, is this a pregnant woman? Is this a child under age 18? Is this someone with a disability? Is this an impoverished senior? Those are the eligibility requirements. We need to get back to actually getting the Medicaid dollars, taking them away from the fraud and actually giving them to the individuals that we want to. We have a couple states, California is the best example, that is ridiculously running their system with overruns and some ridiculous numbers. So putting the rule of law back in, putting efficiency, putting back and making the Medicaid dollars do what they're supposed to be is what we're doing. All you hear from the Democrats, they just love people to be on Medicaid. They want government dependency. Republicans want personal responsibility.
Congressman, I want to ask you about the Department of Veterans Affairs, because we understand that it is preparing for an agency-wide overhaul. They're trying to go back to the 2019 staffing levels, which is around a 15% decrease in headcount. We did hear from Secretary Doug Collins today. He says it will affect about 72,000 positions, but he also says that these cuts will not touch veterans' health care or benefits.
And our understanding is that the VA currently employs 482,000 employees and staff. The number there on the screen says 470, but you can see there's a big chasm. That's a lot of people, but nobody wants to see anything cut for the veterans' care. How's this going to work?
Again, Jason, the word is reform. During the Biden administration, I sat on Veterans Affairs, and 1 out of 10 of my constituents are veterans. But if meeting with Secretary Collins during the Biden administration, by their own admission, overhired. They hired, I think it was close to 80,000 people. They increased spending $180 billion when essentially the number of veterans and veteran services was flat. More came in from the PACT Act, but a lot of veterans got disenfranchised, waiting months and months and months for appointments and just left the VA. Look, it's called efficiency and accountability is here. Doug is the right man to help bring that back to the VA.
Well, I know Doug Collins well, served well with him in the Congress, and he's got good military service as well, and I'm sure his heart's in the right place. Congressman Greg Murphy, Dr. Murphy, thanks so much for joining us on The Bottom Line. Do appreciate it.